Hello everyone. Today we are going to be discussing about an important disease in neurology known as the Guillain Barre Syndrome. So this disease is actually a kind of autoimmune. It's very rare actually, but it is very important. So it was to be talked about actually. So now let us dive into the topic. So this Guillain Barre Syndrome actually is a kind of autoimmune. By definition, is a kind of autoimmune uh, neurological disorder actually that affect the peripheral nerves, the peripheral nervous system actually, that is the PNS, and it actually affect both motor and sensory component, motor and sensory component actually. So actually, the Guallian Barre syndrome actually is a kind of autoimmune, but in most cases, this Guallian Barre syndrome is triggered actually after some kind of infections actually. So now let us dive into the uh, etiology or the causes of this Guillain Barre syndrome. Etiology. So in etiology, actually, we don't know the definite cause of this Guillain Barre syndrome. Actually, the definite uh, cause actually, but we only know that in some patients that are susceptible to develop this Guillain Barre syndrome, they develop a kind of autoimmunity against this neurological disorder. So in most cases, what we already know that is the patient has a previous history of gastrointestinal or respiratory infection actually. So, but in most cases, the gastrointestinal infection, that's gastroenteritis actually. So, previous history of previous history of gastroenteritis, and due to mostly due to a kind of bacteria called Campylobacter jejuni, or just C. jejuni actually. So in most cases of Guillain Barre syndrome is due to gastroenteritis, and mostly the gastroenteritis is caused by this Campylobacter jejuni bacteria actually. And then in some cases, actually a kind of respiratory tract infection, for example, Mycoplasma pneumonia, respiratory tract infection due to Mycoplasma pneumonia is also associated with this Mycoplasma pneumonia. So it's also associated with this Guillain Barre syndrome. And then in some minority of cases, some viral infection like Epstein-Barr virus infection, like varicella zoster virus infection, and then like even HIV actually, HIV, sometimes even lymphoma, all are associated with this Guillain Barre syndrome. And in tropical areas, specifically in tropical areas, we have two virus that are associated with this Guillain Barre syndrome in tropical areas. So in tropical areas, these viruses are Zika virus, Zika virus, and then dengue, dengue virus. So are associated with the GBS, that is the Guillain Barre syndrome, GBS. So that is it. So whatever the case, in some cases they say also hepatitis E virus infection is also associated in many cases of this Guillain Barre syndrome. So now let us see the mechanism. So there are two actually theories to believe on the mechanism of the Guillain Barre syndrome, or how this Guillain Barre syndrome develop actually. So these two variants of mechanism are: number one, in some cases it is due to lymphocyte and macrophage that attack the myelin sheaths of the peripheral nerves. So in the number one scenario is lymphocytes and then macrophages attack the myelin sheath. The myelin sheath actually of the peripheral nerves. While in the other theory actually, or in the other cases actually, only associated with immunoglobulin, that is IgG mediated damage to the cell membrane. IgG mediated damage to the cell membrane. Cell membrane of the axons. So actually, in some cases, lymphocyte and macrophages attack, and then in some cases, immunoglobulin mediated damage to the cell membrane of the axons actually. So that is it. So whatever the case, let us see the signs and symptoms actually of this disease. Signs and symptoms. Signs and symptoms. So in most cases, the symptoms that precede is a kind of sensory symptoms. Is the first clinical manifestation to be seen in a patient with Guillain Barre syndrome actually. So sensory symptoms are the first symptoms to show up or to manifest before any other symptoms of this Guillain Barre syndrome. And these sensory symptoms include tingling, a kind of symptoms that are associated with sensory nerve damage actually, not motor nerve. Sensory nerve damage, tingling sensation, like a kind of numbness actually, also a kind of even pain. And all this started also actually in a kind of from in both sides, because it is bilateral. The symptoms occur bilaterally actually. So because the attack of the peripheral nerves occur bilaterally, so these symptoms definitely have to occur bilaterally. So this tingling, numbness, and pain started from the feet and hands. That is started from feet and hands actually, then ascend upward actually. That is it. So this tingling, then numbness and pain, and also after these symptoms manifest, sometimes even burning pain actually. So after these symptoms occur actually, then motor symptoms will then actually follow. Then motor symptoms. So motor symptoms actually, as the name implies, will actually going to manifest itself as paralysis. That is paralysis. And this paralysis started, or usually used to start from the feet and hands. From feet and hands. That's feet and hands. And then ascend upward. And ascend upward to involve the lower and upper extremity. That is lower and then upper extremities. So this typical pattern of involvement of this extremities is actually known as ascending paralysis, because the muscles that first become paralyzed are muscles of the feet and then muscles of the hands actually, and then from the feet actually the paralysis will ascend upward to involve the muscles of the leg, then muscles of the side. That is ascending upward, right? While in the hands, the muscle of the hands started to, that's when it comes to upper extremity, it started from the hands, and then paralysis began in the muscles of the hand, then ascending to involve the muscles of the forearm, and then to involve the muscles of the arm. So this pattern, because the paralysis is going upward, not from down to downward, that is what we called a kind of ascending paralysis. So this is very, very typical in Guillain Barre syndrome, ascending paralysis. So that is it. Then now let us see some kind of science actually. This science will be like a kind of, there are going to be a kind of decrease reflexes. That is deep tendon reflexes. So that is it. Then now let us see some complications. So most important complication to know is respiratory failure, because muscle of respiration are affected, right? So that is it, respiratory failure. So that is it. And then we have autonomic instability, autonomic nervous system instability, autonomic instability, which may involve what? Which may be associated with postural hypotension, postural hypotension, because if there is autonomic nervous system dysfunction, then there will going to be a kind of decrease in the vasovagal tone, or that is, or let's say the vascular tone, right? If we have decrease in vascular tone, then definitely the patient can have a kind of postural hypotension. So that is it. And then, as when we say postural hypotension, means the patient will blood pressure will drop actually with standing, right? So that is it. And then we have profuse sweating, because even sweating is controlled by autonomic nervous system, right? So if we have autonomic instability, the patient will be complaining of profuse sweating actually, and then so on. Okay, so now diagnosis. Sometimes they may even be having a kind of cardiac arrest, because the controlling of the heartbeat is controlled by actually the autonomic nervous system. The initiation of the heartbeat is initiated within the heart. That's from the SA node. But the coordination, or how the actually the controlling of the heartbeat is going to be whether to beat too fast or to beat too slow is under the control of this autonomic nervous system. So that's it. So if we have, for example, damage to the sympathetic nervous system, so we are going to have a kind of overdrive of parasympathetic nervous system. Now, due to overdriving of the parasympathetic nervous system, then the parasympathetic nervous system will now depress the heart, because no sympathetic nervous system to counteract its action, right? So now the parasympathetic nervous system will depress the heart actually, causing the heart to stop functioning. That's cardiac arrest actually. So that is it. Then diagnosis, based on the, you can have ask the history actually, based on history of based on history of GIT or respiratory infections. That's previous history, respiratory infections, mostly 3 to 6 weeks back. That is within 3 to 6 weeks. So that is it. The patient, if he said, yeah, I have suffered from GIT infection or respiratory infection 3 to 6 weeks back, then definitely you will be maybe suspecting Guillain Barre syndrome. So for you to confirm your diagnosis, so also or your suspicion, then you have to order a kind of lumbar puncture. This lumbar puncture is a kind of the first initial test to order actually. So in the lumbar puncture, you will see a kind of increase in protein and increase in WBC. That is it. And then you have to order a kind of electromyogram or myography. And this electromyography is a kind of way of a kind of actually determining the electrical activity of the skeletal muscle actually, also known as EMG. EMG, that is an abbreviation of it. So now treatment. So for the treatment of this Guillain Barre syndrome, we have to give a kind of IVIG, that is IV immunoglobulin. Immunoglobulin. That is intravenous immunoglobulin, and then plasmapheresis. Plasmapheresis actually. So this is how you will treat this patient. In some cases, you will give steroid actually, but steroid is not that much effective than this thing actually. So thank you very much.